How does chronic stress affect your liver health? Imagine your body as a finely tuned machine where every part needs to work in harmony. When stress becomes a constant companion, it can quietly disrupt this balance, especially in your liver. Chronic stress triggers a cascade of biological responses that can gradually harm this vital organ. One key factor is the releases of stress hormones like cortisol. While helpful in short bursts, prolonged high levels of cortisol keep your body in a state of alertness, which leads to ongoing inflammation. This inflammation can damage liver cells and impair their ability to function properly. Another important pathway involves the connection between your brain, gut, and liver. Chronic stress can alter the bacteria in your intestines, reducing beneficial microbes and increasing gut permeability. This condition, often called leaky gut, allows harmful substances like bacterial components to enter your bloodstream. When these reach your liver, they activate immune receptors that cause inflammation and damage to liver cells. Over time, this process can lead to tissue scarring and even liver disease. Stress also affects blood flow to the liver. Studies in animals show that psychological stress can reduce blood flow by about 60%, leading to a lack of oxygen in liver tissues. This oxygen deprivation, known as hypoxia, causes cellular damage and releases substances that further harm the liver. Additionally, chronic stress increases oxidative stress, which is a form of cellular damage caused by an imbalance between free radicals and antioxidants. This damage can promote liver scarring and fibrosis, raising the risk of cirrhosis. Elevated cortisol levels from ongoing stress also interfere with how your body processes fat. This can lead to increased abdominal fat and a higher chance of developing non-alcoholic fatty liver disease. Research shows that people with depression or anxiety are more likely to have fatty liver, even if they do not consume excess alcohol or unhealthy foods. Higher perceived stress levels have been linked to a greater prevalence of fatty liver in otherwise healthy individuals. For those already dealing with liver conditions like fibrosis or early liver disease, stress can make things worse. The added inflammation and cellular damage accelerate disease progression. Interestingly, some recent studies suggest that reducing stress might help reverse certain types of liver damage. For example, lowering iron-dependent cell death in liver cells, called ferroptosis, has shown promise in experimental models. This indicates that managing stress could be part of future treatments for liver health. Understanding how stress impacts your liver highlights the importance of managing it as part of a healthy lifestyle. Chronic stress not only affects your mental well-being but also creates an environment that promotes liver inflammation, fat buildup, and scarring. These factors are all linked to increased risk of serious liver conditions, including liver cancer. Incorporating stress reduction techniques like mindfulness, exercise, and adequate sleep can support your liver's health. Remember, always talk with healthcare professionals for personalized advice, especially if you have existing liver issues. Taking care of your mental health is a vital step toward maintaining a healthy, resilient liver.